Healthcare workers in New South Wales who are classified as a close contact of a COVID case will be exempt from isolating in exceptional circumstances if they are asymptomatic. It comes as increasing case numbers have led to thousands of people plunged into isolation. Joining me now live is the Acting Secretary of the New South Wales Nurses and Midwives Association, Shaye Candish. Shaye, thank you so much for joining us this morning. Firstly, how big of a difference will this reclassification make?
Look, it will be substantial. There's no doubt about that. But to be clear, the staff are still required to isolate for anything other than coming to work. So they can't stop on their way to or from work, and they will be, required to conform to the same rules as everyone else. It's simply to try and address the absolute staff shortages that we're experiencing.
Well, take us through the current situation. Are you still experiencing the mass shortages that we have seen over the last few weeks?
Yeah, absolutely. We're seeing thousands of staff furloughed because, like all community members, they're part of their communities too. So they are testing positive. They're also close contacts. They're being exposed in the work that they do. But also, when they're out and about seeing family and friends over the holiday season as well.
There's some reports this morning that COVID-positive nurses are being recalled to work in hospitals across New South Wales in breach of state health protocols. Have any of your members been forced to go back to work if they have been exposed?
We haven't had reports of this, but what I can say is there is such significant confusion. The rules are changing so quickly that I wouldn't be surprised to hear that some people may have been incorrectly directed back to work. So we'll wait to see if there are reports of this that come through in any sort of large numbers, or if this does become part of the sort of government directive eventually. But at this stage, we can't confirm that that's happening.
And are you finding that nurses are saying that it's having an impact at the moment on other services?
Look, it's having a huge impact on services. We're seeing huge numbers of patients presenting. They may be presenting for things other than COVID, but when they're there, they're diagnosed with COVID, and that presents an additional level of challenge when you care for those patients, because you're then having to think about how you break those chains of transmission between patients that are all in rooms or hospital units together. So it does make the care more complex, and we're doing that at a time when the hospital system itself is at its lowest point of resourcing because people are off on leave. Then you multiply that with all of the staff that are being furloughed, and we just have challenge after challenge after challenge. And this is a workforce that is now going into its third year of pandemic. So it's incredibly exhausted. And it's a real challenge for people who are turning up shift after shift under these types of experiences.
The New South Wales government maintains that the system is strong and prepared. What more could have been done, do you think, to prepare for the inevitable reopening and the situation we find ourselves in now?
Look, I think the planning was really problematic. When the rules were relaxed back in mid-December, we were really clear, all of the experts were really clear that we would see an absolute explosion of cases. And that's exactly what's happened. And it's happened at a time when our system is at its absolute shortest of resources because people are off on leave. We've had nurses and midwives asked to come back from their leave. And these are people who haven't had a holiday in 24 months already. So, there was some real gaps in the planning. There's no doubt about that. And I understand that the government is claiming that the system's strong. But the reality is our community are coming now to receive services, and it's not at the standard that they expect. So the government needs to come clean and talk to the community about what's really going on.
A difficult situation. Shaye Candish, thank you so much for joining us this morning.
Thank you.